I'm Dr. Poysky, or just call me James. I probably know some of you already for a number of years, but I'll introduce myself anyway. I'm a pediatric neuropsychologist, which is a psychologist with a little bit of extra training in how the brain works and the relationship between brain and behavior and learning, especially in the context of neurological disorders. And I also have a son with Duchenne. He's 20, going on 12 some days. So I've experienced a lot of this stuff as a parent as well as a professional. Now, what I can tell you is knowing this stuff does not make me a better parent. And if you met my kids, you'd know that I have no clue what I'm talking about. So take what I say with a grain of salt. But I do think this stuff is really a passion of mine in talking about this and educating people about this, because it's so prevalent, and also it can be something that is really stressful just for the families. It can have a big impact on the people who have Duchenne. So I really enjoy coming and talking about it, so thank you for giving me the chance to do that. I also am a Premier League football fan, so I might throw a few things in here or there just to make sure you guys are awake and you know, not zoning out or anything like that. So take what I say with a grain of salt in that regard. And this is pretty informal from my perspective, so at any point, you know, jump in. You know, there is a time for questions at the end, but if there's something that I'm saying that just is not making sense in the moment, please let me know. I'm pretty informal. So today, just to give you a quick overview of what we're going to be talking about, obviously we're going to be talking about learning, behavior, and emotional or neurobehavioral disorders, emotional problems, and learning disorders in Duchenne. It's a lot to cover, and so I'm going to be talking pretty fast. And because it's such a big topic to cover, it might not feel necessarily like we're able to dive really deep into any one thing, and so I apologize for that. I really wanted to give people an overview. I find that this topic is of interest kind of in a cyclical manner, where it'll be kind of at the top of people's priorities and their interest level some years, and then we talk about quite a bit, and then that kind of answers their questions, and then kind of a different topic comes up, but then a new generation of family comes in who may have not heard this stuff, and so the importance goes up. So a lot of this is stuff I've talked about before. There may not be anything new or groundbreaking, but I think it's always helpful to cover this, especially for families who maybe are kind of new to this process. So I'm going to be talking a little bit about the causes and implications. I'll try not to be too nerdy when I'm talking about it, and there's not going to be a test later, obviously. I'm going to cover some of the cognitive and developmental delays that we can see when people have Duchenne, as well as specific learning disorders and neurobehavioral disorders, and I'll talk about what that means in a second. And then at the end, I'm going to talk a little bit about what the options are for addressing these things. And that's the part that, you know, we could have a whole conference about each of these topics in and of themselves. So again, may not be as super in-depth as we would like, but you know, at the end, if there are questions that you have about what to do, what can help, please feel free to speak up at that point. I do have to let you know, though, I'm not licensed in the UK, so it's hard for me to be super specific about your specific situation, but I can certainly you know, give some general recommendations and advice in as much as possible. So in terms of the potential causes of the neurobehavioral learning and emotional problems that we can see in Duchenne, certainly as with any kid, there can be lots of different factors that can play into what's happening. And I just made like a quick list, but certainly family dynamics. You know, we often hear how bad parenting can result in behavioral disorders. Just in general, interactions with other peers can cause behavioral distress in kids. Family stress in general. Kids are like sponges. They can soak it up, and it kind of comes out in behavioral ways. But there's also other medical factors, like taking steroids, we know can certainly ramp things up a little bit. Not getting enough sleep. I get pretty grouchy if I don't get enough sleep. Anyway, I didn't list all of the things here. These are just kind of some obvious ones. But one of the things I wanted to highlight is the potential impact of Duchenne itself on brain development and on brain functioning. Now, we don't know a whole lot about this, but there has been some research that's conducted, and I think it's still an emerging area. So, you know, there's a lot of questions that are unanswered, but I think that this one is oftentimes the thing that is overlooked. And it's been a couple years for obvious reasons. But I give these kinds of presentations all over the world, and I still run across families who are not aware that there's a connection, or whose doctor has told them specifically, no, it's not related at all. And so, which is kind of shocking to hear, but I wanted to emphasize this just a little bit. The full-length dystrophin protein is found in your brain, not just in your muscles. I'm suspecting somebody's probably already at least talked about this a little bit, maybe yesterday or earlier. And it's fairly widespread. We're not sure exactly what it does, but it does look like it is in part related to helping neurons work as efficiently as they can. Neurons send electrical signals, and a part of how they do that is there's a chemical transfer between neurons that excites the neuron. The signal moves down the pathway of the neuron and excites the next neuron, kind of like a chain reaction. And there's some evidence to indicate that the full-length dystrophin protein helps those receptors that pick up those chemical transmissions, it helps them localize in the right part, in the correct areas of the neuron, and helps them work in a more efficient manner. And without that, the signaling maybe doesn't work as well. So everybody's missing the full-length dystrophin who has Duchenne. But there's some smaller versions as well of the dystrophin protein. And did someone mention this earlier as well? Maybe no? Okay. So there's some smaller versions. And those smaller versions are present or not based on the point of mutation. And so there's a couple in particular that seem to be most relevant. And not having these smaller versions in addition to the full-length dystrophin protein seems to significantly increase your risk of having some sort of neurobehavioral or learning condition. And in particular, oops, if I can get the pointer to work, DP140 and DP70, if you're also missing those ones, that is not the best thing. Actually, I'm going to backtrack. I'm a little bit out of practice, and I just reviewed it this morning, but it's been a few years since I've given these presentations, so bear with me. But we do see in a few studies that have been done, we can see some very subtle, am I getting feedback here? Okay, there can be some very subtle differences between people who have Duchenne and people who don't in terms of their brain. There do look like there's some differences in glucose metabolism, which is basically kind of how efficiently your brain works. There's some very subtle structural differences. Now these are at the micro level. These aren't necessarily things that if you're to take someone and do kind of a basic MRI that anything different would show up. But it does look like we have some very kind of subtle differences that indicates that there's something going on. Now if you're also missing these other smaller versions, it increases your risk even more that you can have some sort of behavior problem, I'll talk about this later, like ADHD or like a learning disorder. The thing that I want to point out too is that especially DP140, this is a common breakpoint, or mutations often start between these areas here. And so the promoter of DP140 is, I think, between exon 44 and 45. And then the actual protein itself starts at 51, I believe. And that's a pretty common breakpoint. I can't remember exactly, but I want to say, okay, I had to put it up here. About 55% of people with Duchenne have a mutation somewhere in that location. So this is a fairly common missing smaller isoversion. And we can also see where if somebody's missing DP71, then actually they're at greater risk for very severe, significant delays in their development and significant intellectual disabilities. This DP170, it's harder to tell because if you're missing DP170, you're also missing the other ones too. So we're not sure if it's just the fact that kind of you're missing most of them or if it's just DP71 or what the combination is. But certainly based on where your child's mutation is, it can certainly increase the risk. Now, I have seen kids who have the exact same mutation who have differences. I mean, they don't come out kind of like carbon copy and it's not a 100% predictor, but certainly, we're talking about risk factors here. And so, we do have good evidence, not a ton, but we do have evidence that indicates that there is something potentially going on that's different in the brain. And I'm going to skip back just a little bit here. In particular, one of the processes that Duchenne seems to affect quite a bit is with GABA neurons. And GABA neurons are the primary neurons, I would say, that help you put the brakes on and help kind of calm the brain down. And without having the dystrophin protein there, and without those neurons maybe working as efficiently as they should, there are certainly lots of kind of downstream implications for that process going a little bit awry. So, we can't always explain all of the reasons why a child is having behavior problems, or in any given moment, we can't say exactly why that person is falling apart and having a meltdown. But what we can say is, at least in part, there's probably a neurological role in this. I see kids who have excellent parents, and their other children are perfect angels, and yet the child with Duchenne is high maintenance, and that's a diplomatic term. And so, there does seem to be something that's going on neurologically. We can't necessarily know what exactly is happening, or in what way it's causing things to be more difficult, but it does seem like there is some evidence supporting that. So there's been different studies and people have different estimates, but it does look like the majority of people who have DMD have at least something going on. Now, I don't say that in a critical way. I mean, all of us have things that have problems, and certainly can have the risk of having the same sorts of difficulties. But certainly, it seems like the majority. Now, it's not all. I have seen some people with Duchenne who do not appear to have any sorts of difficulties, but certainly more likely than not. And I don't need to state the obvious, but I will anyway. But if you have problems with learning or behavioral regulation or emotional control, certainly that can have a huge impact on your quality of life. It certainly affects your academic progress, your academic achievement, your vocational options, any number of things. But the thing I wanted to underscore most was independence and autonomy. That is something that I think has become more of a focus in the past few years when it comes to Duchenne. I think previously people didn't really kind of think that far ahead for obvious reasons, but that's changed based on the progress that we have in terms of treatment and also some of the things that are in development right now. And so there has been a big shift towards this. And I always want to emphasize to people, the earlier you catch something, the better. And, addressing behavioral or learning problems now certainly makes things better now, but it's almost like a cumulative factor, and the benefit of fixing things now can have huge implications for where they are when they're an adult. I don't want to blow things out of proportion, but I think they're all relevant to independence and autonomy. Also, behavior and learning, neurobehavioral problems can even just directly have an effect on the person's health and on their care. This is my nemesis right here. This is a BiPAP machine. I don't know to what extent you guys use these or have this available here, but this is to address oxygenation at night. And anybody who's worn like a CPAP knows that the masks are not the most comfortable thing. But my son, we've been fighting with him for 4 years. I'm not kidding, 4 years to get him to wear this. And it's affecting his heart, like he's developing scar tissue. Still working on it. So it can certainly have a direct impact on their physical health. And about 10% of mothers that were interviewed indicated they felt like behavior problems actually were the biggest thing that interfered with them being able to provide the care or their child's medical treatment. And this was actually an open-ended question. I think it would have been even higher if it was asked in a more specific and direct way. Certainly, the impact on others can be pretty profound. There's a number of different studies that have looked at parental stress and parental coping in Duchenne as far as parental caregivers. And there's, I think, solid evidence that indicates that parent stress is actually more related to the neurobehavioral and emotional problems of the child than the actual medical aspect of it is. and I don't want to say it's like that for everybody, but the families I talk to, that's definitely the case. And also, there's indication that parental emotional adjustment, not just stress level, but their actual emotional adjustment, is influenced by the child's emotional adjustment. And if it seems like your child is depressed and unhappy and uncomfortable, that certainly has an effect on us as parents. Siblings. Now, there's not really been much research looking specifically at the impact. I don't think there's been any direct research looking at the impact of behavioral and emotional problems in the person with DMD and the effect that that has on siblings. But certainly, in general, we know that Duchenne can have an effect on siblings. And siblings of people with Duchenne are about twice as likely to have problems with emotional distress. I think in some regards, being the sibling of someone with Duchenne, there's some beneficial aspects to that. I think in some regards they can be more mature, more responsible. But certainly, if you have a kid who's melting down all the time and parents are focusing 90% of their time on just trying to manage the behavior of that child, you don't have to be a doctor to realize that's going to have an effect on a sibling. This is one too that I think it really should be looked at. So there's research that's indicated that being bullied at home is just as damaging as being bullied at school. And I often see, especially when you have a sibling with Duchenne who is impulsive, emotionally reactive, oftentimes the non-affected sibling, especially if it's a younger sibling, is the target of a lot of that. And I've definitely seen situations where it's had a direct impact on the sibling's self-esteem and just kind of their emotional status. So that's important too. Again, I'm not aware of any research looking at that directly in Duchenne, but it's a concern of mine. So moving on more specifically to some of the things that we can see in risk factors. And again, just to emphasize, not everybody with Duchenne has all of these things that I'm talking about. But I wanted to give people an idea of things to look for, just in case you're new in this process, or to remind you of. And when it comes to overall intelligence, we see where people with Duchenne have a normal distribution in terms of range of IQ. And there's a lot of problems with IQ tests in general, but certainly we see a whole broad range. I know some young men with Duchenne who are brilliant. They're smarter than I am. There's one guy named Felix. He's getting his PhD at Rice University, which is like one of the top schools in the US. And he was asking me for advice on his dissertation. And I said, dude, this is way over my head. I don't even know what you're talking about here. So they can be brilliant, but at the same time, it does look like maybe there's a larger portion that are maybe falling below average or in the impaired range. Looking at an overall IQ score, though, doesn't always give you the best information. It doesn't tell you about lots of different kinds of processing skills. And also, it doesn't always... IQ tests are made up of a bunch of small tests that we average together. And we can sometimes see a discrepancy in scores where they have some strengths in some areas and weaknesses in other areas. They kind of pull down that overall IQ score. And so it's not always a good representation. It does look like, though, that verbal-based tests tend to be a little bit more problematic than nonverbal tests. And I'll talk just a little bit about that. But verbal tests, obviously, they require language processing. They assess things like vocabulary, explaining ideas, and understanding ideas that people are explaining to you in using language. Visual spatial tests are more things like spatial representations, how things fit together, maybe more like what maybe an architect or an engineer would use, that sort of thing, not necessarily the math. Delays in language development are also a common problem, and estimates vary, but they indicate maybe a third of young people with Duchenne can have a delay in their language. And this isn't just their speech, this isn't just their articulation and how they pronounce words. It can be, but really it's looking more at the use of language to communicate. And so they can be late for their first words, they can be late to put words together, and they can be late in their ability to express complete sentences. And along with that too, we can also see problems with language comprehension. Now, that does tend to improve over time. In my saying that, that doesn't mean ignore it and don't do anything about it, but it does look like there can be progress in this area, and especially when provided with things like speech therapy, it certainly helps them narrow the gap. However, even in young people who their language skills appear to have caught up, they still can continue to have some problems with language development that are a little bit less obvious. So their vocabulary tends to be normal as far as just their understanding of basic words, but they can continue to have some problems with language comprehension, especially processing larger amounts of verbal information that's given to them. They can also have some problems with verbal fluency, which is basically quickly and efficiently stringing words together to say what you're trying to say. And the thing I want to point out is certainly just communication is important, but you have to remember also at school, language is how most information is communicated. It's the teacher standing up there talking about stuff, and there's some pictures, but it's predominantly verbal. And if your language is behind, that certainly affects your ability to understand new concepts and to communicate what you know. And so on average, we can see where their language development is about 2 years behind. So imagine your child going to a grade level that's 2 years ahead of them and trying to keep up. It can be challenging sometimes. So I'll talk about this later, but I always recommend really kind of intense early intervention to try to get people caught up as much as possible if they do have a delay in this. Now, weakness in short-term memory, this is something that we can see in young people, or in people who have Duchenne of any age, as well as any IQ level. It's not dependent on how smart they are or not, or that sort of thing, but we can see weaknesses in this. And if they're hit with kind of too much information at once, their short-term memory kind of shuts down, and it's like overload. And I describe short-term memory as a bucket, and everyone has different sizes of buckets, but information comes in and it fills it up, but at a certain point, it kind of, it's maxed out. Well, people with Duchenne can often have a smaller bucket, and also sometimes if the bucket gets full, it collapses. Working memory is a fancy term that we use for short-term memory, and working memory is being able to take new information in, keep it in mind, but then step back and either analyze it or reorganize it so that you can do what you have to do in a more efficient way. So if I were to tell you, I'd like you to go to the store and get milk, eggs, sugar, butter, and jam, short-term memory would be able to remember that list all the way to the store. But working memory would be getting the butter first, and then the sugar, because that's a more efficient route through the store without forgetting it. That's a terrible example, but bear with me. And this can be a problem. And so especially in school, they can be described sometimes as more forgetful. Or sometimes they're not able to follow multiple steps or directions that the teachers provided them. And I even see sometimes where teachers can interpret this as being oppositional, or they just don't care, but actually they can't remember it. So something to look for. There's some other areas that just clinically, when families come to see me, that I could see some weaknesses in, but I'm not really aware of a lot of research that's actually looked at these sorts of things in people with Duchenne. So I suspect that they might be more inclined to potentially have some weaknesses in these areas, but it's hard to say with how much certainty that's the case. But motor planning and fine motor coordination seems to be an issue beyond just a muscular strength sort of issue. And so, learning to tie shoes and early writing skills can often be more of a challenge. Visualization, which is being able to, based on a verbal description, step back and picture something in their mind. I can see where there can be some weakness in that. And executive functioning, which is a fancy term for things like planning, organization, prioritization. Now sometimes weaknesses in these areas are captured in kind of like a more specific diagnosis that I'll talk about in a second, but we don't have a ton of evidence yet kind of telling us where these things are or what increased risk factor they could pose. And how are we doing on time here? Okay. How much time is it till 10? Till 10:30. But isn't there a question?
Yeah.
Okay. Okay, so now I'm going to talk about specific learning disorders, and hopefully people's eyes have not like started glazing over yet. So bear with me. Now, specific learning disorders are problems learning a specific academic subject despite having, in general, okay overall cognitive development, okay IQ. Perfectly, somebody who has the otherwise has the ability to learn new information. They have difficulty with a specific academic subject. And there's three kinds. There's problems with reading, there's problems with math, and there's problems with writing. And the fancy terms, I'm sure everybody's heard of dyslexia. Most people haven't heard of dyscalculia, and at a party you can have people say it 10 times fast and everybody can laugh, but anyway, that's difficulty with math, and dysgraphia is problems with writing. I'm not sure here about the UK. I think the rates are fairly similar. Maybe Janet, you can speak to this, but in the US about 5 to 10% of kids who don't have Duchenne have a learning disorder, but estimates are much higher, probably about triple the rate in people who have Duchenne. There's also probably, I would say, another 15 to 20% who struggle with these things, but maybe not to the full extent where we would officially call it a learning disorder. And you can also have more than one. I would say that the most common one is probably dyslexia, but certainly there's an increased risk for any of these. Now, the one thing, I hear this all the time, and maybe it's just a pet peeve of mine, and I'm too uptight about this, but all the time I hear people say that dyslexia is a visual problem, where letters are backwards or reversed or moving around on the page. And that's not the case. There was a couple of really bad research studies back in the late 80s that indicated that that might be a possibility. They were subsequently kind of overruled, and the vast majority of research indicates that it's really a problem with the sound aspect of reading. So they can see letters okay, they can see words okay, they're not like moving around on the page, but they have a hard time matching up the right sounds with what they see. And it's theorized to be related to just a general weakness in understanding the sound structure of language. So if I say mat, hat, cat, chat, bat, usually probably around the ages of 4 or 5, kids start to realize that, oh, he's just playing with that first little sound when he's saying that word. But when people have dyslexia, there's research studies that have shown that they don't understand that concept, and they have a hard time manipulating those sounds, which is why oftentimes we call it preschool, is it nursery school? I'm not sure what you call it. Anyway, they do a lot of like rhyming games and clapping sounds, and that's an effort to promote the development of these skills. Well, people who have dyslexia, evidence suggests that they don't actually have, they have a weakness in their understanding of that. And so they have a hard time when they're learning the alphabet, they have a hard time matching up the name, which is basically a random sound, with the letter that they see. And they have a hard time matching up the sound that letter makes. When they look at words, they can see the words, but they have a hard time quickly and automatically segmenting it, just looking at it and being able to segment it into those sounds, and then blend those sounds together, which is basically phonics, right? Everybody's probably heard that term. But people with dyslexia tend to have difficulty with that segmentation and blending process. In some cases, they can actually do it fairly accurately, but they don't develop what's called automaticity in that process. They don't get to the point where they can just see it and do it. Like it's a laborious thing that they have to think through. And so they don't develop like accurate and efficient reading at a level that they really need. So sorry, that's kind of a nerdy tangent, but I have this conversation almost every day with folks. So if you have dyslexia, here are some signs. Like I'd mentioned before, difficulty learning letter names and sounds during nursery school. As they get older, they have a hard time learning how to sound out words. I don't know if you guys use that same term, but segmenting and blending the sounds. They drop word endings, they skip over words. Their reading tends to be pretty inaccurate and laborious. And oftentimes you'll see where they'll just kind of read through punctuation, kind of like a robot. They'll add words that aren't there. Most people with dyslexia can develop some degree of reading skills. It's not that they can't read at all. The problem is like I said before, that it's error prone, it's choppy, and really laborious. And the biggest one that I see is they hate reading. And in my clinic, when I see people come in for this, I always ask them, okay, I know you hate reading, I get it. Do you hate it because it's boring, or do you hate it because it's hard? And usually the ones with dyslexia will say both. Other things, I usually just say it's boring. So that's kind of a red flag, obviously. And writing letters backwards or transposed, that's not necessarily a sign of dyslexia, but that's often the first thing that people will report. That might actually be more related to dysgraphia. I'll talk about that in a second. But anyway, things to look for. Dyscalculia, again, is a fancy way of saying problems with math. This is one of those areas where none of the professionals can agree on what really causes math problems. And there's different theories. There's arguments among, scientists in ivory towers about what causes what. But we don't really know as much. There's not been as much research done looking at dyscalculia compared to dyslexia. But in general, there can be problems in one or more of three main areas. And one is understanding math concepts. This is kind of the abstract nature of math, the symbolic representation of it. What does it all mean? And so early on, we can see problems identifying patterns. We see problems estimating value, so for example, if I do 12 plus 26 and I get 10,342,000, I might not know what the right answer is, but I can eyeball it and know that's nowhere close. People with dyscalculia, they have a hard time with that. They can have problems with math operations, which is basically remembering the steps needed to compute math problems. So which side do I start from? Where do I reorganize things? Like borrowing and regrouping can be confusing. There's also some indication they can have difficulty visualizing an internal number line, so being able to kind of picture it in their head and count backwards. And we can also see difficulty with memorizing math facts. So counting on fingers, having to use number charts because they can't just memorize those math facts and kind of automatically quickly pull them out.
So James, on the operations part, would it also be then when they're given the correct steps by a teacher, but actually still using an operation, but using those steps in a different format to come up to the same answer or a different answer?
Yeah, and that's a hard one to know, right? Because on one hand, we want kids to be able to do what works best for them. And so we encourage a little bit of variability. Some schools, at least in the US, like to emphasize you have to do it the way the teacher taught it. And they make it even way more confusing than it needs to be. You have to show your work is the common refrain. But it's so confusing about 10 steps just to do a simple problem. So that's harder to answer because sometimes the way it's taught is not intuitive. And there's lots of different math curriculum out there, and some of it really is not very good. So I don't know if I can give you a specific answer. But if a kid can't do it anyway, then that's a bigger concern. You know what I mean? Okay. So these are some problems that we can have, or that we can see. Oftentimes, early on, they can have difficulty just learning to count. They can have difficulty with skip counting. I don't know if you have that same, but counting by fives, counting by tens, that sort of thing. Oftentimes, kind of one of the biggest red flags that I see is they have a really hard time visualizing word problems and being able to know kind of what the word problem translates into, like what kind of operation to use, what the main point is. And it's not related to a problem with reading. Even if a kid has dyslexia, oftentimes the actual word level of the math word problem is lower than what their reading ability is, so that doesn't seem to explain it. But they can have a really hard time visualizing it. This is strange, but telling time with an analog clock, that's often kind of like a red flag. I don't know why, but it's something that we see. But just in general, math anxiety is an actual thing. And I mentioned that before with the reading, but when kids have dyscalculia, I mean, it can be overwhelming and shutting down, crying, it's a big red flag. So, All right, dysgraphia, people use the term dysgraphia to mean different things. Some people use it as a reference to just problems with the fine motor pencil control aspect of it. Some people use it in a more broad sense to explain problems or to define problems anywhere kind of in the writing process. Fine motor pencil control is probably the most common one that I run across. Just in general, it's a common issue in children. And you can see where they have a hard time making the pencil go where it needs to go. And they also have a hard time developing kind of the automatic fine motor movements to do it quickly without having to think about it. So similar to these other things, kids with dysgraphia, they can write, but the problem is it's very laborious and effortful, and it does tend to be very error prone. So like they'll make letter reversals, they'll start writing letters in unconventional places. If writing a T, they'll start at the bottom and go up and go across rather than kind of starting at the top and going down. We can see problems with interspersing upper and lowercase letters, like within the same word. Most kids will have problems with B and D, usually through about second grade. I don't want to say most, but some can, through second grade even when they don't have dysgraphia. But if it's continuing beyond that, then that can be a sign of that. The bottom one, though, is the one that I run across that's most often overlooked. And this usually shows up in mid-elementary school. And some kids can have problems with ideation, which is basically thinking of what to say. And the more open-ended and unstructured the writing task is, the more that shows up. So if the teacher asks them, I'd like you to write 2 sentences about your winter holiday, it's like a deer in headlights. Like they'll stare at the page, they can't think of what to say, and even if they can, it'll be kind of like, it snowed, or it was cold, and kind of just have kind of like a couple of facts stated, but there's kind of they're not really cohesive and doesn't really go together. Oftentimes this is interpreted as oppositional behavior. He's just not trying hard enough, or he just doesn't care, or he's just lazy, but they actually have a hard time thinking of what to say. Oftentimes, these are kids too where they have a hard time with this just even kind of general conversation, and they have a hard time relating a sequence of events. So what happened at school today? Like, say there was a problem. Tell me what happened, and you get 10 different versions, and it's out of order, and you're still not sure what happened. And sometimes it even looks like they're being evasive, or they're trying to make up a lie, but then, I caught you in your lie because your story didn't make sense. But they actually have a hard time with the generating and sequencing of ideas. And writing is the academic task that requires the most of that, and so that's usually where it shows up. I already kind of covered this to some extent, so I'm not going to go over that again. Just in general, if you're seeing a discrepancy in most academic areas that are strong, and then one area that's particularly weak and frustrating and causes meltdowns, that's usually a red flag that we're potentially having a learning disorder. Again, I'm not saying kids have to love school, but if they're flipping out about one specific kind of academic task, don't disregard that. And did you?
My son has a tantrum every single morning saying he doesn't want to go to school because he hates writing.
Mm-hmm. Yep.